Hi everyone, it's great to be here with you. We're here with our beautiful patient Jackie. Thank you so much for allowing us to film this, Jackie. And I just want people to hear from you what brings you here. Tell us what bothers you, please.
Okay, so something that's been bothering me for a while now is the lines around my mouth when I smile, so the smile lines, and little pieces of skin that have been dragging here. Around my jawline.
Great. So she looks great. She looks amazing. But you can see what bothers her is her laugh line. And one thing I was mentioning to her, what's contributing to these laugh lines is that unfortunately in our 20s, we begin to lose some fatty tissue up here, and it's this fatty tissue that's basically holding everything up. In her case, some of the things that I think we can make even better is by putting a little bit of filler in her cheekbone out here, what we call laterally. So we're going to put it here and here to pull this up. I told her she's beginning to develop what we call a tear trough deformity, which is just a little bit of hollowness under her eye, which is beginning to cause a little bit of fullness on her lower eyelid. So we're going to put a little bit of filler here to improve that. When I inject here, it would also pull up her laugh line. By the way, when we inject here, not only her jawline that bothers her will improve, but her laugh line will get pulled back. So once we do here and here, we'll assess the laugh line. A lot of times it improves on its own and we don't need to put anything here, but if there's still a little bit of residual laugh line, we'll put a little bit of filler here. And lastly, one thing that I mentioned to her is she's got a receding chin, and it's this receding chin that's causing some early signs of downward pull on the corners of her mouth, what we call this sort of malolabial fold, and it's the receding chin that's also sort of causing a little bit of this jowling. So we're gonna just use the filler almost equivalent to a little bit of a chin implant. Obviously it's not surgery, but we're gonna put a little bit of filler on her chin, which will help make this area tighter. Okay? Is that okay with you?
Yes.
So we're gonna go ahead and get started. Again, less is more. We can always add more later. My goal is to make sure patients feel safe here, that we're not overfilling, that they know that we can always enhance it down the line if necessary. But at the same time, we want to correct it properly so that she sees a difference. These fillers will last up to 2 years. So here we go. I'm going to switch to the cannula and just fill in this little bit of hollowness under her lower eyelid. You're going to feel a little pinch.
Oh my god, my face is like not symmetric at all.
Yeah. But what do you think?
It looks a lot better.
So do you see how obviously the lower lid, that crease that was kind of going at an angle is much reduced? You have a little bit of cheekbone. And her jawline, your jawline's a bit better. You don't notice that heaviness as much. We're not done with it because we still have to do the chin. And this is a little softer. We're still going to fill that in, okay? But I'm going to go to the other side, okay? So you can see how she's got really nice cheekbones. Her lower lids are definitely fuller. This heaviness is improved, and most importantly, like, look at her laugh line. It's so much better. I want you to tell me what you think, okay?
Oh my god, definitely. You could see it.
You have such beautiful cheekbones. You know, an ideal like feminine face is what we call an inverted triangle, where your chin is really narrow and these are a little bit wider. But you can see how your eyes improved, your cheekbones a little further out, and these got better. And look at your laugh line.
100%.
And that is the key, is about really, sometimes patients present with complaints of laugh lines, and in a lot of patients, actually the underlying cause of the problem is elsewhere, and we have to address that versus just going after the laugh lines. I don't think you need anything here anymore.
Okay.
We'll assess it next time you come in 2 weeks, and if this is still here, then I'll put some in here for you. I always take into account how there's improvement over the next 2 weeks. And I don't want to put too much here because in women it just kind of can make it too full and it makes it look masculine. But right now this is so much softer.
So much better.
What I'm going to do is now work on your chin.
Okay.
Okay. So this is so important that we didn't really go into an area that already was like actually bothering her. Actually all I did is put a syringe in her upper cheek and her lower lids, and her laugh line improved, and so did her jawline. We're going to make her jawline even better by addressing the chin now. If you notice, you had kind of a lot of hollowness on your chin, but you can see how your chin is just fuller. These hollows are gone. You had like a little downward pull forming. But if you notice, by rebuilding your chin, actually this heaviness, you don't even notice it anymore. You have a much sharper jawline. It lifted it up. So I was conservative. We did a syringe on each side. Most likely, I have a feeling we're going to do a little bit more in about 2 to 3 weeks again here. If necessary, of course, but just from experience, I know usually takes about 3 or 4 syringes to really build the chin out nicely. But already, just in a conservative way, we just put a little bit on each side, and you can see, again, just to review, her cheekbone is so much fuller, her lower eyelid is better, her laugh line improved dramatically, her jawline, which is one of the things that bothered her the most, is pretty much gone, and she has this incredible, nice chin. So that was it. You're welcome. How did it feel to you? Honestly, was it painful?
No, not really.
What did it feel like? Little pinpricks?
Just, yeah.
Was the cannula uncomfortable?
Not really.
Okay.
Like I heard it more than I felt it. Yeah.
Yeah, you hear the crackling sound. Good. All right, we look forward to seeing you.